Hello and welcome to Focus Asia from our studios in Hong Kong. I'm Joe Kimes. Our program tonight begins in Pakistan's northwest frontier province, a region dominated by the ethnic Pashtun people. Family is everything in Pashtun society, so there's great pressure for women to bear children to continue the family line. But rather than visit a doctor, women unable to conceive often look to folk healers for an answer to their infertility. This woman longs for the one thing that will earn her respect in a society dominated by men. She's going to pray at a small but special shrine, a place she hopes will hold the answers she desperately seeks. We'll call her Salima. She doesn't want to be identified in part because of the stigma involved.
I've been married for 10 years and have yet to bear a child. I've tried all sorts of traditional remedies for my problem. And then somebody told me about this shrine. It's famous for healing childless women. Now I'm hopeful that I too will be blessed with a child.
Folk healers have told Salima she's infertile because of impurities in her body. She must fight this infection with ancient rituals involving brushes, rocks, dabs of oil, and pinches of salt. One of the most poignant symbols, small stones tied to pieces of cloth, representing an infant and a cradle. And sometimes the potential cure involves great discomfort. This folk healer shows us how goat skin is stretched over a patient's body. The woman is ordered to remain in darkness and seclusion for 3 days to allow the pungent hide to extract impurities believed to be causing her infertility.
We strongly believe in these shrines and rituals because our ancestors have been practicing these remedies for many, many years. So we make sure we follow in their footsteps. The shrines give us constant hope, so it would be quite difficult without them. We feel better, and at least we have something to look forward to.
Other rituals involve food. Here, herbs are burnt in a small cooking pot to create purifying smoke. The pot is then brought in contact with bread dough, previously placed on the barren woman's stomach. Anthropologist Samar Minalla, herself a Pashtun, has been studying the fertility rituals of her people. She says they illustrate the harsh realities Pashtun women face in rural areas.
In order to survive socially, it is vital for a Pashtun rural woman to have children of her own. This gives her a culturally acceptable identity in the society, and this sort of an identity also symbolizes security. In fact, the more male children she produces, the higher the status in her society. A childless woman is seen as an inadequate wife and even as an incomplete human being.
In Pashtun society, a child is considered a gift from God, so all of the folk remedies practiced here must be backed up with prayer. But the shrines also offer would-be mothers another important blessing, a place where they can temporarily escape the intense social pressure to bear a child. The pressure partly stems from the isolation of Pakistan's northwest frontier province. The region has relatively little access to education and modern medical care, so tradition fills the void.
After marriage, if there's a delay in bearing a child, social pressures start to mount, and even advice on infertility treatment start pouring in. And there's this constant fear and threat that the husband might remarry for the sake of the continuation of the family line. And professional help is rarely sought.
60-year-old Kushrang Orang is the proud father of 8 children. While he has sons to carry on the family line, he worries about his daughter, who has yet to bear a male child. To Orang, such concerns are natural when the very stability of the community is at stake.
In Pashtun society, having children is very important. People without offspring are called Mirata, a word which sounds very negative to us. Things are also bad for those who do not have a son. They fear their property will go to their paternal cousins. No one wants that because it causes family feuds. And besides, a childless person has nobody to look after him when he gets old. Only Allah can help him. And the entire community feels only pity for his fate.
Even after children are born, superstitions persist. Tradition calls for a sharp knife to be placed in bed alongside newborn babies.
We have long believed in this practice because the knife protects the child and the mother from evil spirits. In fact, they feel more threatened if the knife is not beside the baby. Besides, it's the way of our ancestors, and we feel the need to follow their example.
Some treatments, though, cause great concern among health professionals. Among the most disturbing, a persistent belief that even children lost during pregnancy can be somehow saved. Dr. Saida Jamila was shocked to discover the extremes some families go to.
This girl came to me, a patient from Sadar. She was in a very bad state, and she said to me that she had recently miscarried her child. Her mother-in-law had forced her to swallow the aborted fetus. The mother-in-law believed the miscarried child could be reborn if the girl would eat the remains. The girl couldn't stop vomiting afterwards, and I had to treat her and try to explain that it couldn't possibly make any difference.
Anthropologist Summer Minala says that lack of education, coupled with ingrained beliefs, is preventing couples from discovering the true causes of their fertility problems.
Most cases of childlessness are solely attributed to the shortcomings of a woman. That is one of the main reasons why professional help is rarely sought. Like, it is discouraged that a woman should go and see a doctor. So the only option left for a woman is to seek refuge in shrines or in some fertility rites, folk treatments, and they really strongly believe in the power of ritual.
While many women are content to follow the beliefs of their mothers and grandmothers, frustration is raising doubts for some. Now past the age of 40, Salima knows that her dreams of a family are fading with each passing year.
Not only women, but also the men are under so much pressure from the people of our village. They will ask my husband to remarry to assure the continuation of the family line. That's my biggest fear.